in reaction to a statewide hospital bed shortage and a lack of health services in rural and underserved areas of the state, the legislature enacted the Local Hospital Districts Act in 1945 to allow local areas to seek voter approval to form health care districts, or hospital districts as they were known at the time, for the purpose of building and operating hospitals. The original intent was to provide underserved areas with a source of tax dollars to construct and operate community hospitals and health care facilities. 85 such districts were formed under this law. Since then, depending on how you define it, somewhere between 26 and 30 healthcare districts no longer operate hospitals or healthcare facilities. Some of the 30 districts operate clinics or ambulance services, however. Almost half do not and have any kind of healthcare services, and instead are operating health and wellness programs, grant programs, and even health enterprise programs such as gyms and children's activity complexes. From an accountability standpoint, it's appropriate to review the evolving nature of these units of government and measure them against the original function and purpose. It's also appropriate to question whether these districts need to continue to exist as government entities and whether another local entity could more efficiently fulfill the public purpose that they now serve. During these economic times especially, the legislature should reasonably question the use of scarce local resources for purposes other than basic health services for those who are sick and or uninsured. The committee has chosen to look at 3 very different health care districts. One in San Mateo County that runs a robust grant program, one in Contra Costa County that has spent the vast majority of its revenue on administration, and one in Los Angeles County that runs health instruction, fitness, and other enterprises. All 3 districts are public agencies receiving local property tax dollars. All 3 districts are in counties that have double-digit uninsured resident rates. According to the California Health Care Foundation, 6.9 million Californians are without health insurance. The UCLA Center for Health Policy Research estimates the following uninsured rates for the counties in which the districts we're looking at this morning are located. San Mateo County, a 14.3% uninsured rate. Contra Costa County, 17.4%. Los Angeles County, 28.9%. We often hear our colleagues and other members of the public calling for less government. Except for reducing health and human services and education funding, we too rarely look at doing a better job of meeting our most pressing needs with the resources that we have available. As we explore these specific districts, we should not only question if they are serving a valuable public purpose, but question if it is the highest priority public service and if it is appropriate for government.